Hello, and thank you for your time to join us for this presentation that will provide you with an insight of HE National Overseas Sponsorship Team. I am Sada Parvez and I work for the OST at the Health Education England based in West Midlands. And today I will be providing you with an overview of OST's responsibilities towards the international doctors in England. HE can only sponsor the trainees in a recognized training program. If a trainee leaves the training program for a period of time or obtain the certificate of completion of training, HE can no longer sponsor the training. OST coordinate this centrally for all of the England and are based within the West Midlands. I also would like to emphasize that the OST are not immigration experts. We can only provide guidance on the skilled worker visa sponsorship and cannot provide any legal advice to the trainees or employers on any other immigration related categories or issues. In the next slide, you can see the responsibilities of the OST as outlined. We are responsible for issuing the certificate of sponsorship to the trainees, which include checking the course applications once the trainee has been made an offer. As part of our sponsorship requirements, we also carry out reporting and monitoring activities that include reporting any changes in the trainee circumstances during their training program. We aim to do this to the UKVI within 10 calendar days of the event, and we also ensure to maintain the records for all trainees in our system. We also liaise with the UKVI on any complex issues and review any updates to the UKVI legislation and policy to ensure that we are meeting our compliance and statutory requirements. Our team also produces indefinite leave to remain letters for the trainees that are sponsored by HEE. The next slide outlines the responsibilities of the employers, which includes ensuring that the trainees have got the correct right to work documents. The employers should also ensure that the original BRPs or online immigration status are validated and stored for the sponsored trainees. They're also responsible for maintaining records for the trainees and ensuring to update the local HE offices and OST in regards to any changes to trainees' information via a reporting form. They're also required to provide absence information to the trainees as and when this is required, and also any other employment letters requested by the trainees. Moving on to the next slide, the responsibilities of the trainees include that they will be required to liaise with the HE local offices to obtain a certificate of sponsorship application and apply for a visa in a timely manner. They're also required to keep their local offices and OST informed of any changes in the immigration status or in their personal circumstances. They also need to ensure their personal contact details are communicated through to the relevant local teams for the trainee information system to be updated. They will also need to contact the OST when they require an extension to their current visa. Trainees who have been allocated a status of offer accepted on oral will be contacted directly by the OST where they require sponsorship. OST will process application forms and supporting information in preparation for the certificate of sponsorship to be issued to the trainee. The earliest we can apply for a course is 3 months from the start date of the training program. During our busiest times in May, June, and July, trainees could receive their course at any point throughout the period. And we will be processing applications based on the priority order showing on your screen. Once a trainee has received their course, they can make their application to the Home Office. Trainees can apply for the health and care visa, which will be confirmed by the HE on their course. The next slide overview whether a trainee can start working without a visa. Please note that these requirements are only for a normal year. I will be providing you with an overview of the concessions that are in place for 2022 in the next slide. If a trainee is submitting an out-of-country application, if they're coming from a different sponsor or they're switching the immigration category, they must have their new visa in place before they commence their training program. If they're continuing their sponsorship with HEE, they will need to ensure that they submit their visa application before the visa expiry date, and the employer can do a check on employee checking service to confirm their immigration status. If a trainee is switching from a student visa to a skilled worker visa, then they will need to ensure that they submit the visa application before the program start date. An ECS check will need to be completed as it will provide the employers with a statutory excuse and meet their right to work requirements. The next slide will provide you an overview of the concession that is in place for 2022. The UKVI has continued to offer a concession to allow the employees to commence work before the visa application has been granted, only if the following conditions have been met. If they have been assigned a cause and they're applying under the health and care visa, if the trainee has submitted the visa application before the visa expiry date, and if they're making the application within the UK. You can also find further information about this on the link as mentioned on the slide. The following slide covers delays for 2022 in process of visa applications in response to the humanitarian crisis due to the current situation in Ukraine. As a result, currently, the UKVI have suspended priority and super priority services for new study, work, and family visa applications. Applicants who have submitted an application using the standard route may experience some delays in the processing of their applications. If a trainee requires an extension to their current HE visa for any reason, such as they failed their ARCP, they've got gaps in their training, then they will need to contact us and we will process their extension. We will issue them a new course so that they can make the application to the Home Office to extend their current visa with HE. There has also been changes in 2022 for the foundation trainees. In the previous years, foundation trainees received a student visa for the duration of their foundation program. From 2022, all the new starters to the foundation program or any other foundation trainee needing an extension will be provided with a skilled worker visa. This also means that any trainees who were previously issued a Tier 4 visa can continue to work on their current visa until it's expired. The employers will need to ensure that all trainees who are currently sponsored with HE have got a correct right to work document. They must ensure the applicant's current right to work is valid and allows them to work as a doctor or a dentist in a training program. It should not have any restrictions on the visa to work in the UK. HE can also only sponsor the trainees on the skilled worker visa. Therefore, we are unable to provide any guidance on any other immigration category or right to work checks. Our team can request a copy of BRP or an online share code in order to meet our sponsorship duties. Please note that from 6th of April, any applicant who holds a BRP can only evidence their right to work using the Home Office online checking service. Employers can no longer accept the physical BRP card for the purposes of right to work check. The trainees will be provided with a share code that begins with a letter that denotes the purpose it can be used for. So, for example, if the share code starts with R, with the letter R, it is used to evidence their right to work. For work purposes, please ensure that the share code must start with the letter W. In the next slide, we will go through the reporting and monitoring requirements as set out by the UKVI. All the changes in the above section should be reported to OST using the reporting form. The information should be sent to the OST within the 5 working days of the change happening to ensure the OST can report this to the Home Office within the 10 calendar day limit. The information can be sent to OST via the trainee or the local HE office or the employer. OST inform the trainees of their requirements to report the changes in their circumstances when they apply for their course. Trainees are also required to sign the conditions of sponsorship outlining the requirements and confirming their agreement to this. In this slide, you will see the requirements for a new starter. The maximum of start date can be delayed for a new starter is 28 days of either the start date stated on the course or the date of when the skilled worker applications was granted, date of entry clearance, whichever is later. The start date in training for all sponsored trainees should be the date mentioned on the course. Where this is not possible, the following criteria should be met. This slide overviews our further reporting to monitoring requirements, which we will need to report to the Home Office. If a trainee has terminated earlier than accepted, which includes they have resigned after commencing work, they have been dismissed by the sponsor, they have been made redundant by the sponsor, and they have completed their work early, we will be required to withdraw the sponsorship from the trainee if any of the following have occurred. HE will also stop sponsoring the trainee if they've moved to another sponsor, if they've moved to another immigration category, or if they've been absent without pay for 4 weeks or more and is not covered by the exceptions. Please note that the sponsored workers can only take short periods of unpaid leave, but unless an exception applies, it can only be a maximum of 4 weeks or in total in any calendar year, which runs from 1st of January to 31st of December. The only exceptions to this are as follows: if they're taking adoption leave, if they're on statutory sick leave, if they're taking part in legally organized industrial actions. This includes the changes to the trainee salary, which could be due to changing in their working hours, where the trainee has gone less than full time. In most cases, trainees can reduce to a minimum of 80% less than full time to maintain their sponsorship, if they've taken a period of unpaid leave, or if they have gone on sick leave. When a trainee is on a statutory sick leave, they will continue to be sponsored by HEE. Employers will need to keep track of the sickness locally and will need to update the OST at the following stages, so these can be reported to the Home Office at the correct period. When the salary has decreased to half pay, when it's decreased to no pay, and when the doctor has returned to work and is back to full pay. And the fourth one is if the trainee has gone or is going on maternity or parental leave. The next slide covers any changes to the trainee circumstances, which includes if their location has changed, which would relate to interdisciplinary transfer between nations. Trainees can move freely within their region, and this does not need to be reported. If there have been any changes in their job title or duties or the specialty, if there are changes in their working hours, if their employment has been affected by TUBE, or if the trainee is completing an out-of program. If a trainee decides they want to take time out of training and apply for an out of program, this needs to be reported to OST. For the majority of OOPs, rather than OOP-T for training, HE will need to withdraw the sponsorship for the duration of the OOP, but then can sponsor again when the trainee returns back to the training program. The next slide covers the information that does not need to be reported to the OST, which includes the trainee's annual leave dates, their authorized study leave dates, any sick leave dates where there has been no effect to the pay, the paternity leave where the pay is unaffected, any changes in their address or passport details, and if the trainee are moving to another trust within the same region. In the next slide, you will be able to see an overview of the certain documents that employers are required to keep for the duration of the trainee sponsorship and until the end of the training program. These documents include a copy of each trainee's current passport, a copy of their verified BRP or online right to work check, a copy of their national insurance number, a copy of trainee's DBS check, a record of their absences, which may be kept electronically or manually, a copy of the first payslip, a copy of their contract of employment, and a detailed job description confirming the duties and responsibilities. They're also required to keep a copy of any qualifications they hold to confirm the skill level and evidence of GMC. In the event of a UKVI audit, there are some things that they may be requested by you from the OST. As now we've gone through the sponsorship requirements, there will be implications if we fail to comply with the immigration requirements. HE must comply with the UKVI regulations in issuing cause and be aware of all trainees' current circumstances and report any changes to the Home Office. If they're not met, HE can have the sponsor license revoked, which means the HE will not only no longer be able to sponsor any future doctors in training, but the trainees who are already sponsored by HE will no longer have a valid right to work, and the sponsorship will be revoked. This would have very serious implications, potentially leaving big gaps in the service needs. If a trainee seeks advice on the possibility on working for another employer on their current HE visa, it is important that they obtain the correct and latest advice. Currently, trainees can do additional 20 hours paid per week if they are still working as a medical practitioner and at the same level. They can also do unpaid voluntary work. The Home Office has recently introduced that if a trainee wishes to work more than 20 hours per week or work in a different occupation code, they can obtain a certificate of sponsorship and apply for a new visa with a second employer. As part of trainees' ILA visa applications, OST issues letter to the sponsored trainees. Unfortunately, HE do not hold the trainees' absence data centrally, and therefore trainees will need to request this information directly from the employers for the ILA visa application. We are also aware that employers may or may not know if periods of leave were inside or outside the UK. Therefore, we ask that you confirm all the leave that has been taken by the trainee. Our team has developed a useful set of FAQs for common questions asked by the trainees. The link that you can see on your screen also includes further information on less than full-time, outer programs, ILR, and the reporting form. Please note that OST main point of contact is via emails. You can contact us at sponsorship@he.nhs.uk. I would like to thank you for your time for listening in today.